Okay, so are you ready to really dive deep into the world of pharmaceuticals?
Yeah, I'm excited for this one.
This time we're going way beyond, just reading those labels on your pill bottles. We're talking like a real deep dive.
Right into the chemistry.
Well, yeah, but also the history, the impact these medications have had.
Yeah.
On all of us.
Makes you realize how powerful these little pills can be.
It really does. And the source we're using for this deep dive is actually this incredible podcast by Dr. Khalid Hassan. And he's a serious medication expert.
Yeah, I've heard of him. Didn't he compile that list of the top 200 most prescribed drugs or something?
Yeah, exactly. He's got this whole list, and we're going to be zeroing in on the ones that start with F.
Oh, interesting. F drugs. Should be fun.
Yeah. And you might be surprised how many of these you actually recognize. We're talking Pepcid, Prozac, even Flonase.
Wow. Yeah, those are everyday names, but I bet there's a lot we don't know about them.
Oh, absolutely. We're going to uncover how they actually work in the body and the impact they have on our health, beyond just those catchy TV commercials.
Yeah, I'm curious to see what's behind the curtain.
Right. So let's kick things off with the first one on the F list, which is Famotidine. You've probably heard of it by its brand name, Pepcid.
Oh, Pepcid. That's the go-to for heartburn, right?
Yeah, exactly. And also ulcers.
So how does it actually work? Does it neutralize the acid in your stomach?
Well, sort of, but it's actually a little more sophisticated than that. Pepcid or Famotidine is what's called an H2 antagonist.
H2 antagonist. Okay, break that down for me.
So basically when you eat, right, your stomach starts churning out acid to, break down your food.
Right. Digestion 101.
Exactly. But sometimes your stomach goes a little overboard with the acid production, and that's what causes that burning sensation we call heartburn.
Okay, makes sense. So Pepcid steps in and soaks up all that extra acid.
Not quite. It's actually pretty clever. It blocks a specific type of receptor in the stomach that's responsible for telling it to make more acid.
So it's cutting off the acid at the source.
Exactly. Imagine putting a lid on a boiling pot. Stops the overflow.
That's a good analogy. So no wonder it's also used for ulcers. I mean, those are basically sores in your stomach lining, right? Caused by too much acid.
Exactly. Pepcid helps to, heal those ulcers by preventing further damage from all that excess acid.
Pretty impressive for a little pill.
All right, so moving on to the next F drug on our list. And this one is all about managing those tricky triglycerides.
Triglycerides, aren't those a type of fat in your blood?
Yeah, they are. And having high levels of triglycerides can actually be pretty dangerous for your heart health.
Really? How so?
Well, imagine your blood vessels are like highways, right?
Okay, I'm following.
And triglycerides are like these, huge trucks clogging up the lanes.
Ah, I see where you're going with this. So high triglycerides mean traffic jams in your arteries.
Exactly. And that can lead to all sorts of problems like, heart attacks and strokes.
So how does this drug help with that?
So the drug is called Fenofibrate, and it has a couple of brand names too, Antara and TriCor. And it basically acts like a, traffic controller in your blood vessels, helping to clear out those triglyceride trucks and keep things moving smoothly.
So it's lowering those fat levels in your blood, preventing those traffic jams from happening.
Exactly. And that can significantly reduce your risk of heart disease. So it's not just about, fitting into your skinny jeans. It's about keeping your internal highways clear and healthy.
Yeah, that's a good way to put it.
All right. Now, this next one's a little more sensitive, and I think we need to approach it with, a bit of caution. We're talking about fentanyl.
Oh, fentanyl. Yeah, that's a pretty powerful painkiller, right?
It is. And, while it does have legitimate medical uses for managing severe pain, it's also unfortunately become, the center of the opioid crisis.
Yeah, that's true. It's a tough situation because on one hand, you have people who genuinely need it for pain relief, but then you have the misuse and addiction that's causing so much harm.
Exactly. And, it's a stark reminder that even medications that can, save lives can also have devastating consequences when they're misused.
Definitely a double-edged sword.
Okay, let's shift gears to something a little more everyday. Ferrous sulfate.
Ferrous sulfate. Does that ring a bell?
Well, you probably know it better as Feosol.
Oh, Ferrosol, the iron supplement, right.
You've got it. It's basically the building block for red blood cells.
And those are important because...
They're the ones that carry oxygen throughout your body, little delivery trucks.
Oh, right. And if you don't have enough iron, Those trucks aren't running at full capacity.
Exactly. That's why people with iron deficiency, or what's called anemia, often feel tired, weak, maybe even a little pale.
Makes sense. So popping an iron pill can basically give your body a much-needed boost.
It's like giving your body a tune-up. Okay, now for a couple of names you might not be as familiar with. Fingolimod, which is also known as Gilenya.
Gilenya. I think I've heard of that. Isn't it used for like multiple sclerosis or something?
You got it. It's actually a disease-modifying therapy for MS, which is a really complex neurological condition.
Right, and it affects the nervous system, right?
Yeah, the central nervous system.
Wow, so that's pretty heavy-duty medication.
It is. And then we have Fluconazole, which you might recognize as Diflucan.
Diflucan, that sounds familiar. Is that an antifungal?
Yes, you're right on track. It's used to treat all sorts of fungal infections, from like athlete's foot to, more serious systemic infections.
So these last two drugs are perfect examples of like how diverse the world of pharmaceuticals really is.
Absolutely. From managing heartburn to treating complex neurological conditions and everything in between.
It's mind-blowing, really.
And speaking of mind-blowing, this next one is really interesting. It's called Finasteride, or Proscar.
Proscar? That sounds familiar. What's that one for?
Well, this is where it gets interesting. It's actually used for two seemingly unrelated conditions.
Oh. Lay it on me.
Okay, so it's used for BPH, which is an enlarged prostate.
Okay, that makes sense.
But it's also used for male pattern hair loss.
Wait, what? How does one drug do both of those things?
That's the crazy part. It all comes down to, hormones. Finasteride inhibits the production of a specific hormone, which is involved in both, prostate growth and hair loss.
Oh, wow. So it's like a 2-for-1 deal.
Exactly. It's like a key that fits two different locks.
Yeah.
And it's a testament to, the ingenuity of the scientists who developed these medications.
That's pretty amazing.
Okay, now for a drug that's practically a household name, Fluoxetine.
Fluoxetine, is that Prozac?
You got it. Prozac was a real game changer when it was introduced.
Yeah, I remember hearing about it. It's like an antidepressant, right?
Yes, and specifically it's an SSRI, which stands for Selective Serotonin Reuptake Inhibitor.
SSRI. Okay, now we're getting into the technical stuff. What does that even mean?
So basically, serotonin is a neurotransmitter, which is like a chemical messenger in your brain. And it plays a huge role in, mood regulation.
So if you don't have enough serotonin, you might feel depressed, anxious.
Exactly. And that's where Prozac and other SSRIs come in. They basically help to increase serotonin levels in your brain.
Oh, I see. So it's like boosting your mood by increasing those happy chemicals.
Pretty much. And that's why it's so effective for, treating depression and anxiety disorders.
That makes sense. So are all SSRIs the same? Like, would Prozac be as effective as, say, another SSRI like Zoloft or Paxil?
That's a really good question. And it's something a lot of people wonder about. And the truth is, even though all SSRIs work on that same basic principle of, increasing serotonin, they do have these subtle differences.
Like what?
Well, for one thing, they have slightly different chemical structures. And that can affect, how they interact with your brain and how well they're absorbed by your body.
Oh, okay. So it's kind of like, even though they're all playing the same song, they each have their own unique sound.
That's a great way to put it. And because of those differences, certain SSRIs might be more effective or better tolerated for, specific conditions or individuals. It really depends.
So it's kind of like finding the right key for the right lock, even within the same category of medication.
Exactly. And, speaking of finding the right key, this next drug is interesting because it appears twice on Dr. Hassan's list. We're talking about Fluticasone.
Fluticasone. Okay, that one doesn't ring a bell.
Well, you might recognize it by its brand names, Advair and Flonase.
Oh, Advair and Flonase. Wait, are those not like totally different medications? One's for like asthma and the other's for allergies?
You're right, but both of them contain Fluticasone.
Huh, that's interesting. But how can the same drug be used for both breathing problems and allergies?
Well, it all comes down to how it's delivered and, where it's targeting in the body.
Okay, explain that.
So Fluticasone is a corticosteroid, which is a really powerful anti-inflammatory medication.
So it reduces swelling.
Exactly. And in Advair, which is used for, asthma and COPD, it's delivered directly to the lungs through an inhaler.
Makes sense, because with asthma, your airways get all like inflamed and constricted, right?
Exactly. So the Fluticasone and Advair helps to, calm down that inflammation and open up the airways so you can breathe easier.
Okay, I get that. But what about Flonase? That's a nasal spray, right?
Right. And in Flonase, the Fluticasone targets the nasal passages. helping to reduce inflammation and congestion in the nose.
So it's basically the same drug, but it's being used in different ways depending on the condition you're trying to treat.
Exactly. It's like a versatile tool that can be applied to different parts of the body.
That's pretty neat. I never realized that.
All right, so moving on, we have another SSRI on our list, Fluvoxamine.
Fluvoxamine. Is that like Prozac?
It is an SSRI, but it seems to be more commonly prescribed for like OCD and social anxiety disorder.
Oh, interesting. So it's like a more targeted approach to anxiety.
Exactly. And this just goes to show that even within a class of drugs like SSRIs, there can be nuances in, how they affect the brain and which conditions they're most effective for.
It's like there's a whole world of subtle differences between these medications.
It really is. And it's a good reminder that there's no one-size-fits-all approach to medication. What works for one person might not work for another, and there are so many factors to consider.
Yeah, it's definitely not as simple as just popping a pill and hoping for the best.
Okay, last but not least, we have Furosemide.
Furosemide. That one's not ringing a bell.
Well, you probably heard of it by its brand name, Lasix.
Lasix. Okay, yeah, that sounds familiar. But what's it used for?
It's a diuretic.
A diuretic, so it makes you pee a lot.
Well, yeah, but there's a reason for that. It's basically like the plumbing system for your body.
Okay, I'm intrigued.
So diuretics help to flush out excess fluid from your body. And that can be really crucial in managing conditions like, heart failure and high blood pressure.
Oh, right, because fluid buildup can put a lot of strain on your heart and blood vessels.
Exactly. So Furosemide or Lasix helps to get rid of that excess fluid and, keep things flowing smoothly.
Wow, what a journey through the world of F drugs. It's incredible how diverse and impactful these medications are.
It really is. I mean, we've covered everything from managing heartburn to tackling, complex conditions. And it just makes you appreciate the complexity of human biology and the incredible work that scientists are doing to develop these medications.
Yeah, and a big thank you to Dr. Khaled Hassan for compiling this amazing list and, for sharing his knowledge with the world.
Absolutely. So, after going through all these medications, it makes you think, how do doctors even begin to figure out, the best treatment for each individual patient?
It's a great question. I mean, with such a vast array of options available, it must be a really delicate balance of, science, experience, and personalized care.
Definitely a lot to consider.
It really is.
Yeah.
It will